Hello guys. Today's topic is should you go for the piles operation, hemorrhoids operation? And answer is definitely not. Never. You should never go for that operation. Okay. And I will tell you the reasons and my experience and my story. Okay. That operation I have done 4 years before. It was on I think 2020 or 2021. I have gone through this surgery. So after that I have started a lot of problems. So actually this problem is I will state uh, from when I have got this problem. Okay, this problem I have got from my child, like teenage. I come to know that from my teenage, that I got this problem. Rarely occurs. Okay, so and persist continue for my life up to age of 40. At the age of 25 I started smoking. After that 6 month I think I got severe attack of this piles, and I got some weakness, but nothing happened serious. Okay, so he stays for age of 40, and up to that time I don't have any complication, like serious complication. If I eat too much food, in 2-3 months I get was on this bleeding, piles bleeding, hemorrhoid bleeding. Then it will bleed for 1 to 3 days. Maybe sometime thrombosis occur in veins, so it pain little bit. So, but yeah, then I started. It attacks come and to start building. So then I stop eating much food. So in 2-3 days it will cover, and that's just, and it heals it, and no pain and nothing problem. And I also don't have external hemorrhoid like it's only internal and painless. Sometimes it create pains, but only if I doesn't control my food and diet and eat too much heavy foods plus spicy food. So what my problem is, my food related problem is that I never get acidity with eating. Actually, I observe, my observation says that you have two types of bodies. Okay, one is that some people on eating food they got acidity, and any person who got hemorrhoids or piles he never get acidity. In my life I never get acidity. Okay, so I never get acidity. My only response from the body is to just have a piles, and bleeding is my complication. Okay, but whatever I eat I never get acidity or any problem. Okay, so I can eat much food. A lot of people used to ask me, you can eat more than normal person. So but I never get any complaint, like people got severe acidity and they can't even eat any more food, so they got uh, painful. That is a situation, it's not comfortable for them, they got acidity. Okay, but I never get a problem like that. I only get some gas in my stomach and little bit discomfort. I press my stomach, so the gas will come out, and just I press my stomach little bit and it will vanish in, like it will be normal in for 4, 5, 6 hours. I don't take food in next 6 hours, it will be normal. So generally I eat more than normal person, and it leads me to 1 or 2 months a little bit attack of piles, some bleeding. Okay, but that's okay. I never get vertigo, never get any complication, and I am so happy with that. Okay, so so that is my medical condition. It's not medical condition, actually it is a compensation mechanism developed by your body. Some people develop acidity, so they cannot eat much more, they got discomforted, and some people got piles. But benefit of piles is one, I can eat much more. I don't get any discomfort. And second one, I never get diabetes. I was overweight, I was eating more, but up to the age of 40 my sugar is always less than 200. Okay, how much I eat it doesn't matter, but I, by my observation, the person who get acidity they develop sugar or diabetes, or on the age of 10, 20 years later, age of 40, 50, they start developing diabetes, because their stomach composition mechanism is only acidity, and they will Every time they got acidity, they damage their stomach. Okay, so my observation is it's just a hypothesis, but I never get whatever I have piles, and I never get any sugar complication, and my blood pressure was little bit high, 140, and it was stage from 10 years. 10 years before, at the age of 30, I was like 130, 40. Now at the age of 45, I have BP of 40, 45. Like next 10 mm just changes, and my weight is constant from the 10 years. Okay, so I have gone through surgery. Now the, what happened? Some people said you have done some mistakes in life and I should that blah blah. So you should go through pain, and they were not talking. My family and other my colleagues and whatever my circle is not talking to me. So I got through this painful procedure. It's just a bullshit. Okay, you don't go through life for any painful situation. Okay, don't do unnecessary surgery. That is my advice to you. Okay, no unnecessary surgery. Okay, yeah. If you need it, necessary surgery is needed, you go for it. It's no problem. Surgery is for a lifetime. Okay, it will change you for a lifetime. You have to live with it for your whole life. Okay, once you done it, you have to live it with it. Okay, so that happened, and I had 2020, the 21, I have done this surgery. So after that 4 years, now it is 2025, I'm recording this. So what happened? Then I am, whenever I eat more, actually I just used to go to my office and come back. So little bit exercise happen, and daytime I don't eat. But in my house, when some holidays, I take some holidays, 1 to 3 days. So then I just stays in home and eat 2 times heavy food. Okay. Then his problem started. If I eat 2 or 3 days, 2 days I eat heavy 2 times heavy meal, then it create a big problem. Like I have started pain. My just I have started attack. Attack was what's the attack? Okay, attack. I feel like my head is gonna blast out. And then I just get up from the sleep. I was resting and it just started happening. My tremors in hand, and just my head was about to be blast, like something gonna blown out inside my head, like that pressure or something. I don't know. It was painful kind of. So then I get up and I start walking. It just subsides. Okay, so I do start doing that whenever I in my life. I never feel such a complication in my life. I never had such a feeling in my life. But whenever from up that operation, I started that feeling. I have eat heavy food for 2 or 3 times. Just after 2 or 3 dinner, whenever I take morning heavy dinner, I take evening dinner. After 20 or 30 minutes, I started that feeling. I was resting in bed, and it just gonna about to my head is about to gonna blast, and tremors in hand, and it was not stopping. But I come to know that if I walk or run, so that complication subsides. So I started that. Whenever I feel that, I started running. But this complication 2 3 times happen. But I think like 6 7 months, 3 4 attacks. One attack I feel that I was running, I was doing some exercise, but that pain was not going away. And that day I just afraid of my life, because it was not stopping. I feel like I gonna fall down, and my head was so excruciating pain I am feeling in my head. This is gonna something gonna bleed out or something. I don't know. Something blast inside my head. It's gonna blast something inside, like that, and I am unable to maintain my posture. I cannot stand. I have feeling that I gonna fall. I gonna fall now. So that was a horrible experience. And after that, I just decided to decrease my food. So after that, if I am not hungry, I don't eat much food. I decreases my also food. I am hungry, I take food, and it was always a little bit less food. I eat 1 2 chapati or whatever. Some portion, 30% portion I have decreased in my food. Okay. After that, it was okay. But once after 1 year like that, one holiday I was 2 3 holidays. there was some snacks. My wife made some bhaji snacks, oily things, spicy, oily things. So I was resting and just eating. Then suddenly I started pain. There was a pain in my back for 1 year before that, but it's not very serious. A mild pain. Whenever I stand, so I have pain in my back. Okay. So and I cannot bend over to wash anything. Uh, I cannot bend over and pick anything or do anything with bending over in my back. So that was the problem. So it was a little bit. So I started stop doing all these things, and that pain was not going. Okay, mild pain was there, but I am unable to perform my normal routine things. But one day I eat a little bit more, and in my opinion, that was not a very good or very heavy food. But I just eat and resting and just eating. So that then after sleep or I don't know 7 8 hours, or next day I started feeling of severe pain in my back. Severe pain in my back, and I am not able to wake from my bed. Hardly wake up from my bed, and I have to support my hands. I have to take help my hand to get off my bed, and I can't walk 4 5 steps. Also, it was painful in my back. Very. It was not a power. It was just a pain, severe pain. And then I stop eating. Okay. The next day I sleep, and after I wake up, I was feeling that I am not able to see from my right eyes. Right eyes. This. So I was going to duty, and my I cannot see from my right eye. Then I feel like maybe something happened, or some infection, or some conjunctivitis, whatever, some due to fever or something. Maybe I am not seeing. So I feel like that. I was driving and I just closed rub my right hand. I was not seeing nothing by my right hand. I just rub my left hand. I not seeing anything from my right hand. So I feel my right hand had some problem. So I feel 7 days it will be recover, but it doesn't recover. Then it was I was worried. So I go to ophthalmologist. He checked me. Uh, and luckily it was not a retinal or macular problem, and it was just a cataract. I don't know how it get me in 1 day, but still I didn't see from my right eye. And then I go. He told me to go hire a surgeon for ophthalmoscopy and fundoscopy, whatever. So I go and I check myself. He also tell me that you should go for cataract surgery. You have cataract, and I said okay. But what? So I tried to go for. But what's another problem? I started. I never had diabetes before my surgery, before 21. But after surgery, I developed this diabetes problem. My sugar will be always like 300, 350. So due to the sugar, I was not unable to go through my eye operation. Okay. So that was still pending. So I'm trying to whatever. Okay. So that was pending still. My operation is still pending due to diabetes. So this was my story. Okay. So my opinion, what happened that if I have cut my all anal veins, that is piles are veins. Okay, this hand veins. Okay, this you can see in hands your veins. So they dilated, and what happened if I they cut my veins from the anus, and then what whenever I eat, so it started bulging inside my head, my back. There are a lot of veins, posterior vena cava. It supports all the veins from stomach and rib cage and all that. So that my veins start dilating. I think my head veins also start dilating. My back veins are also dilating, and I am also feeling that sometime I have feeling of tingling sensation in my leg. So my venous plexus in leg also is dilated. So I can't eat anymore. Nowadays I eat a little bit morning. Morning breakfast I have done. So I started feeling of pain in my neck. I don't know, but this plexus, venous plexus, is dilated. Okay, that is a serious complication. Okay, so you should not go for. So whatever I have. The all thing my experience, you should not never ever go for this surgery unless you have protruding that veins, dilated piles veins come out of your anus external side, and it will stays outside after toilet. You go to toilet, and that will create you pain in sitting or any daily activity. You should go for surgery and only cut that outside vein, not the inside plexus. Okay, you should save it for your life. Okay, if you cut that, you are in big trouble. Okay, same story for my uncle. He also gone through. He's now dead, but rest in peace. But age of 75, he's dead now. So at the age of 50, I think he gone for the surgery. And at the age of after 10 years, he was totally paralyzed, unable to do anything. And after that, he at age of 60, at the retirement, I think he's paralyzed, nearly paralyzed. After that, he lives 20 years with the support of his family members. Everything he done in his life has to be supported by his family. Toilet, urine, eating, everything, bathing. He cannot perform his job. So, and also another story I heard from some person. That person gone through same surgery, and he was died at the age of 58. He was a healthy guy. He was also having a very severe backache. He can unable to walk. So that is just two story I can correlate with you. Okay, in my opinion, they have the same problem. I also started the same, but I was a doctor and I am taking care of myself, and I know little bit and figure out little bit problem. What's the problem? Heavy eating is the problem. I cannot do that. Before surgery, I have that piles, and I can bleed through, and it will decrease my venous pressure, decrease anemia. My body reset to anemic, and I can digest more food like that. But now I cannot do that. I can overeat myself. Okay, so all this story I have tell you. So and one thing I also used to tell me. I just forget one thing. Okay. So, in my opinion, you should never ever go through this surgery unless very severe anemia happen. You have pain after going through toilet. It will not reside. Pain will not reside. It stay constant for the day. You should go. And I have tell benefits of it. You can eat any much, but it as much as you want. You will get only complication like that, bleeding through 2 3 months or once a month, and it will be painless, not much complication. You decrease the food and this, and you never get diabetes. Pious patient never get the diabetes. That is their um, benefits, I can say. Okay, so thank you all. I have tell my story. I hope this will help you to get a better life, and just having good life. Thank you all. Thank you.